For more on how to move away from the state of disaster, we're joined by Associate Professor and Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal, Professor Mosa Moshabela. Professor Moshabela, good evening to you. Thanks for your time tonight. Look, it's interesting because government insists on the fact that it is, following the science when it comes to this issue. And yet we know that the Ministerial Advisory Committee has long said that it believes that the state of disaster needs to be brought to an end. And there seems to be unanimity within that body about this position. So which science is the government following?
Greetings, Kathy, and to the viewers. Yeah, I think that the government is having trouble communicating the decisions. I think from a science perspective, there's two things. We can look at where we are now in terms of the pandemic, and we can look at where we could be in a few months. And if we anticipate, we know that there's a chance that we can see new surges of infections. We cannot then decide purely based on the current situation, even though we agree that for the current situation, we need to relax restrictions. So now, the problem is that there is no definition of when the pandemic ends scientifically, at least from the World Health Organization. If we knew that there is a clear definition of when we can declare the pandemic has ended, then the decision to end the state of disaster would be easy. So now what I think needs to happen is to negotiate to say if the pandemic continues for, additional months to go or maybe a year, then what is a compromise that we can reach in terms of even within the pandemic, how can we safely move out of the state of disaster? This is where the negotiating issue is. And I think it is therefore not only a matter of science, it is also a matter of the law. It is also a matter of our capacity to respond. It's matters of issues of trust and consensus. And I think that's where the problem with the miscommunication is right now. Science alone is not going to solve this problem. We know right now that from the scientific perspective, we would appreciate if the law could allow us to move out of the state of disaster, but still be able to manage the pandemic since it is persisting. That's the position that most of the members in the MAG and most of the scientists are taking, but really we need the law to be enabled.
Professor Moshabela, we've long been told that this is, a virus that we're going to have to learn to live with. And now that we are at that point where government would at least be somewhat justified in relaxing some of the restrictions that are still in place because some of them simply no longer make sense, and create a culture where people understand that this virus is not going anywhere. Instead, they seem to be stuck in terms of what the next phase should look like, and yet they're the ones that have been saying for 2 years that we need to learn to live with this pandemic. So of course it raises the question of, well then what have you been planning in terms of what society is going to look like living with this pandemic?
Yeah, no, I think in terms of the preparation for us to move out of the state of disaster, national state of disaster, we can admit that government is not ready. And we saw with the release of the proposed regulations by the Minister of Health that, we need to comment on until the 15th of April, that it's really only now that government is getting its act together to try and make sure that the legislation is going to allow us to be able to manage the pandemic. I think that most of us can agree that these steps could have been taken earlier. But I do think that part of the problem is that we have generally managed to deal with the uncertainty of COVID-19. Most people probably hoped that the pandemic would end, and if the pandemic doesn't end, they hoped that when we reach a high percentage of vaccination, then it'll make it easy to make these decisions. But both of those things haven't happened. And in South Africa, even our coverage of vaccination is still not that high, and it makes it difficult for government to then make decisions about how to safely move out of the state of disaster when there is still a large proportion of members of society that are not vaccinated, unlike what we see in other parts of the world. So all of this, Kathy, to be fair, they create a lot of uncertainty around making these decisions. But I do have to admit also that I think from a legislative point of view, we could have been doing this work much earlier. And we can see now that there is some action in terms of making sure that labor law is allowing us to do this, health law is allowing us to do this, and I expect that even education and other kinds of laws, we might start to see a little bit of movement there.
You're talking about the current gazette that's out for public comment. And again, there are inconsistencies, even when you look at things like public gatherings. And that is what contributes to people losing trust in the system, is that sometimes the rationale simply does not apply. And one doesn't get a sense of a clear flow of thinking and reasoning from government itself about why it is proposing X over Y in some of these scenarios.
Yeah, and I think, again, that it's a problem that we have raised many times in terms of, again, communication, public communication, how to clearly articulate the thinking of government in such a way that it is transparent, it is logical, it is easy to follow. And I think I have to say that, again, that cannot be defended. This is something that we've raised multiple times, that the communication can be a problem. But I do think that what we are seeing at the moment in terms of inconsistencies is probably a reflection of the tensions in the debates that government is having in terms of what to pick up, what to leave behind. Those uncertainties are creating quite a bit of tension for government to then know what is it that they need to do. And it's reflected in the messages that are being sent out in the Gazette itself. But I want to believe that we do have an opportunity as the public, including the scientists and others, to be able to make comments on that Gazette in such a way that we can at least try to help them straighten the language. I don't know who's advising in terms of the sort of language that is being used, but definitely the consistencies can be removed, and they can remove a lot of confusion, both for the public, but also among the sort of healthcare workers and implementers of policies who are also asking themselves the same questions. So I think that it's progress in my view, because a month ago this document was not even out for comment. But I agree with you that I think we need to do better in how we communicate these things to the public, even in written form as it is currently.
All right, Professor Mosa Moshabela, let's leave it there for tonight. Thank you for your time.